69, according to global records, is the highest number of children born by one woman. The journey to birthing life starts in utero, way before the female child is born with resources to be a child bearer.
As at 20 weeks, when the baby is still inside, all the eggs the baby will have in a lifetime are all there. Usually starts around 20 to 30 million. That number is the number that is fixed for every female child. That number, by the time the baby is born, would have reduced to 1 to 2 million. Because a lot of those 20 million are not going to be useful. They will just die off. So by when the child is born, 1 to 2 million, from the time the child is born up until the first menses starts, she has just about 30,000 to 50,000 left.
My grandma's younger brother's wife, she has about 11 children. And we're like on the matter of her being pregnant again. And she said nobody should disturb her. According to her, she wants to give birth to all the children in her tummy, all the eggs God has put in her tummy, because she doesn't know which one will be a doctor, which one will be a lawyer, which one will be an accountant. And I think there are many more women that have that mentality. I think I was about 11. Just newly entered secondary school, I think JSS2. And I bled for 4 days.
Menstruation is a big deal. In my family, from where I'm from Ibadan. If you have your period, they literally kill chicken for you. Yeah, it's a big thing. So I entered the bathroom, opened up, and I saw something dark. It wasn't normal color. It was a weird ass color, which made me scared. I'm like, Mom! She comes rushing in. She was like, oh my God, we need to celebrate.
I just know that my mom told me I'm a woman. She said that if a man touches you, you'll be pregnant, blah, blah, blah. As far as explaining what menstruation was, she didn't do that.
My uncles came in to congratulate me, my big uncles. I'm like, why is everyone congratulating me? People are not supposed to know that I'm bleeding through my vagina. But at the end of the day, it started, and since then, it's been coming.
For the longest, I know I started, having sex and unprotected sex, and you expect that, one day mistake will just happen and you just get pregnant. But for me, it never really happened. It did happen in my 20s. It did happen when I, became 30, when I got to my 30. When I became 32, 33, I felt like I was ready to have a child. Like, okay, I think I'm ready to be a mom. I want to be a mom. I didn't care if I was married or not. I just wanted a baby. I didn't have any delays. I didn't even try to conceive. I wanted to wait. I got married 2021 December, and I got pregnant January 2022. So I had already told my husband that we should wait, but he had other plans. And I got pregnant a month after my wedding. So it was like immediate for me.
I was on contraceptive, the IUD, the iron one. Yeah, and I got pregnant with it. So I went to the hospital when I missed my period. I was like, what's going on? Okay, I did the test and it came positive. So I went to the hospital and the doctor said, well, yeah, it happens.
The journey towards conception was a huge surprise for me and my partner, because at the time when we were pregnant with our child, we were still dating, but in a very, very serious relationship that was heading towards marriage, of course. So we had gone to introduce ourselves to our parents, to let them know this was what we wanted to do. Dates for introduction had been planned out, family were already planning, and poof, the ball hit the net.
Was I actively trying to conceive? No, I wasn't. I'm a planner. I plan myself. I'd met the man of my dreams. We were getting married, and I said, hey, see me, when it comes to things like that, I plan. I know what the cycles, I mark the calendar, I know when I can get pregnant, I know my ovulation period. I am very calculative. And when I wanted to get pregnant, I told me, hey, look, listen, you see this month, we're gonna get pregnant this month. And they're lucky me because it doesn't happen for all women like that.
I mean, I never actively tried to conceive. I remember the first time I was pregnant, I didn't even know. I missed my period, and then I think I found out when I was about 6 weeks gone. Okay, I missed my period and I took a pregnancy test with a strip, and I found out I was pregnant. So I wasn't actively trying. That's when I found out that I had some fibroids that were relatively big. I remember the doctor telling me that the fibroid was about the size of a 3-month-old baby or a 2-month-old baby. So that was the size of the fibroid that I had.
The fact that the fibroid is there doesn't really stop her from getting pregnant. But the other factors associated with the fibroid being there also can cause some local reaction that doesn't make the process smooth. So the sperm can have difficulty in getting to the egg. You understand me? And there are some specific locations you can have fibroids that will completely not even allow it. If you have fibroids at that fallopian tube or at the opening of the fallopian tube where the sperm will just pass through and go, definitely it won't allow. So, but we generally don't see it as, fibroid causes infertility, but it can factor in as to what can cause infertility.
Infertility basically can occur for different reasons, but there's some lifestyle modifications that can help in improving one's chances at fertility. First of all, smoking, alcohol consumption, they're not good for pregnant women or women who are anticipating getting pregnant. This is because high levels of alcohol and smoking can tamper now with the immune system of a woman or of anybody generally, and can predispose them to having increased risk of miscarriages and some other things that can prevent them from getting pregnant. Also, generally, if a woman is on the big side, that's if a woman is obese, she can have some other comorbidities that may prevent her from getting pregnant, which could be diabetes, which could be hypertension, could be what we call metabolic syndrome X. That's a combination of dyslipidemia, obesity, hypertension, and diabetes. Also, PCOS, one of the particular symptoms or signs now in PCOS patients is obesity. And if they're able to reduce their body weight, that's by regular exercising, dietary modifications, that can help improve symptoms and also help with fertility.
When I found out I was pregnant, because I don't miss my period, I don't miss it. And if I do, it's maybe just some 5 days or 10 days of delay. So when 10 days, my husband called me, Alpha, have you seen your period? Didn't click. I said, no, I'm not seeing it. As at that time, that month, I said, I've not seen it. So he now said, are you expecting it? I just said, no, I'm not expecting it. And I was like, okay, maybe this thing it don't happen. I was telling myself, I don't want to do tests. So I will not be disappointed. Let me just leave it. Let me leave it. So after that time, I was not at home. So when I came back home, I just, let me just go and do this test. So when I did the test, I saw that, it was possible. The woman just said, congratulations, they're pregnant. I said, okay. This is it.
The minute you find out that you're pregnant, you start feeling it. That's very true. The night I found out I was pregnant, I started feeling pregnant. I felt heavy. You know that it feels like you're carrying a drum in your lower belly. It's unexplainable, but that's the closest thing relatable to me. It feels like you're about to start your period, but your period is not here yet. That's how it felt from the first trimester. I was happy, so I was in a good mood. My skin was good, especially the skin. Oh my God, see that beauty, that first 3 months of beauty. You would think that you're the most beautiful person in the world. Jeez, because my partner was happy as well. It was like a dream come through for him because he always said it. Oh my God, I wish, you were pregnant for me. So everybody was happy. The family, everybody was expectant that, wow, this is good news. So it was really great for me.
The very first time I found out I was pregnant, that's my very first pregnancy ever. I was excited, but at the same time, I was like, now wow. I don't know how to explain that now wow feeling, And I was thinking, I'll just take it a day. I didn't think anything would change about my life, honestly.
I did not have serious cravings, but I knew that my pregnancy was like an escape time for me to eat whatever I want to eat, because I know that after delivery, I'm going to cut down so many things.
First one, I didn't have any appetite. Now, I had no cravings whatsoever for the first and second pregnancy. I didn't have any cravings. The first one, I was just trying to eat. I didn't have appetite or whatever. Second one, everything was just normal.
I had a high blood pressure because of pregnancy. I have never had it before. It was very new to me. And I was put on medication. I wasn't getting enough sleep, and my baby in my tummy was very active only in the night. Only in the night. So in the night, I don't sleep. So by 6 o'clock, I'll just send my husband a message on phone, and my husband was very afraid to sleep on the bed with me. So he was sleeping in the guest room, and I was sleeping alone. So I'll just send him a text message and say, I just went to sleep now. So it is when I wake up that I wake up. And they'd be like, okay, so, but even that didn't help with the blood pressure.
With my first pregnancy, at the 3rd trimester, I developed a breathing complication.
I don't know why that happened, but I was fainting a lot.
I would be here in an open space, in a very breezy or airy room, and I still can't breathe. I open my mouth, my nose, I'll be gasping for air.
Faint in the market, faint in the kitchen, faint on my way to eat amala.
It was like something was suffocating me from the inside. I'll be doing, I had one help I scared away. I thought that Madame was going to die.
Never experienced this kind of thing before. I couldn't sleep. I couldn't eat. I couldn't drink water. Like every time, my parents would say, drink some water. My sister said, drink water. I couldn't drink water. I couldn't eat. I couldn't sleep. So I used to force myself, to do all this stuff. And sleeping became a nightmare. I didn't want to believe it was childbirth. I didn't want to believe it was pregnancy, because why? Every time I slept, I couldn't sleep because I felt like oh God, it's crazy. My whole right arm became numb. There was one time I couldn't lift my right arm, so I thought it was a joke. I didn't understand what was going on, because why? I've done everything the way I did my other kids. I didn't do anything differently. I wasn't thinking. I wasn't depressed. I wasn't going through any mental torture. It was the same thing.
But the 40 weeks was it just came and went.
December 10th, I just sat down. I literally was sitting down the way I'm sitting now. That's it. And I felt a gush. It was like pee, but it was like pee that you cannot hold.
Prom. is the basic word, which means pre-labor rupture of membrane. What it means is that the bag that is surrounding that baby bursts open for some reason or the other before the contraction starts. Are you getting me? Ideally, what's supposed to happen is that contractions will start, the bag will burst open, baby will come out. But if it happens that that bag bursts open before the contractions of labor start, you say it is prom.
We're not even anywhere. We're just getting to 30 weeks. Still 29 going to 30 weeks. How is it water?
If it happens before 37 weeks, it becomes a preterm prom.
Hey, I quickly called my doctor. He said, "Are you sure it's water?" I said, "It's water." He said, "And it's not pee." I said, "If it's pee, will I not know? It doesn't even smell like pee." I said, if you are sure it's not pee, you have to start coming to the hospital right now. Meet me, I'm on my way. When we got there, they now took me for a scan. They wheeled me there. That was when the woman just told me that I cannot see any water.
What can make a child to be delivered preterm? One, it can be medical. It can be a medical reason. For example, the mother has very high blood pressure with protein in the urine, the one we call preeclampsia, which they need to save the mother's life. So they may need to bring the baby out even when the baby is not yet term. The baby is not yet 37 weeks. So that may be the cause of a preterm delivery, but the mother is bleeding. They need to save the mother's life and bring the babies out. In addition to this, even these conditions can also cause the mother to go into labor, go into preterm labor, and eventually give birth to a preterm infant. Other conditions are infection of the womb, infection of the genital tract, even urinary tract infection can make a woman go into labor. Another very life-threatening condition for pregnant mothers are a mother having infection of the covering of the baby sac or the chorioamnionitis. They may need to bring the baby out because the mother's life is at risk as well as the baby's. So those are some of the reasons why a baby may come out alive.
Everything I'm going to narrate now kind of boils down to the fact that even we as mothers that attend antenatal, expectant mothers, they don't really tell us in detail what we will see in that labor room. They just teach you what you should eat, what you should take to make your baby okay, healthy, up until it's time to give birth. I feel like we should be mentally prepared also for what goes on in the labor room. Because our house was kind of far from where the hospital was, and I wasn't feeling myself, I was very uncomfortable. We had to lodge in a hotel. We just got into the reception and had barely taken a room. I had barely made my entrance into the room when my water broke. It was quite embarrassing because I was just there, a big woman, and people thought I was peeing. Do you understand? In public. So I had to go back to the hospital. When we went to the hospital, that was when they now took me serious.
I wasn't contracting anymore. I was not dilating anymore. And from that time, I said, okay, girl, you need to do this. You're wasting time. And there was just too many voices in my head. At that point, I started feeling fear. I was so afraid. And then I
So they did the cervical ripening. They had this catheter that they're going to insert into your vagina. Painful. It is very, very painful. So this time they couldn't find my cervix. So the first doctor who did it put it on my vagina, right? Instead of where the cervix was. So he put it on the vagina. And it was just the inserting of it. They'll put this syringe, it's like a syringe, it's like actual syringe, right? I don't know how, you know when something looks like hook and they're putting it into your body. It's crazy, painful, and you have to open your legs. So they're putting you on a very high chair. Your legs are open wide and they're seeing straight into it, and they're putting that thing inside for the catheter to be able to stay there. Then they will screw the catheter there. They tried several things. There was an injection they did. There was just several things that they did. It didn't work. So after like 7 hours, I called the doctor. I was like, Dr. Williami, I am tired. I am exhausted. I've been here. This thing didn't work for days. What do you want to do? And he was like, Mrs. Odushesi, we're just going to have to go to an emergency C-section. Please call your husband.
I was telling the doctor, I can't breathe. I just felt, how will I give birth to this child and another person will take care of this child?
So I had gotten to 10 centimeters, about 11, and then I had to push. I was bragging, while I was pregnant. No, you're not going to give me a epidural.
I'll tell you for sure, I have not really experienced labor pain.
12 a.m., 1 a.m. I started screaming at the top of my voice.
As soon as my distance is on 2 centimeters, they give me epidural and I don't feel anything. I'm numb.
I was screaming. I said, epidural, bring it, please. I was begging. I said, my son, madam. I said, you want to see my red eye?
When I got into the room, they had put the anesthesia in me. I had laid down. I just felt like people were pulling me. From one side, you're pulling me. And I'm a very inquisitive person. There's a blockage. I was trying to stand up to look at. The doctor was like, can you lie down back, madam?
Maybe because of the emergency, they did not know that I had fibroids or I had that big fibroids. So the man now went to say, what are you actually doing that is making, because they were pulling me. I said, this is not normal. Like the thing was, I was big, and they would tear me apart. I started throwing up by green vomit, spit, everything, everything was just doing me. My eye was spinning, everything was wrong. I said, yeah, I've never seen that. This kind of reaction is crazy. So the man went behind the blockade to say, what's happening? I said, actually, they could not see my baby, so they were removing fibroids. They were removing fibroids, and they don't do that. Like they don't do, I think it's myomectomy or something, and C-section at the same time, but they had to.
Sometimes when you have to undergo an elective cesarean section, it's not something that is planned. You don't prepare for it.
So they had to remove the fibroids before they removed that.
Before then, I felt like everything was under control. They asked me to push. I think I was too tired to push.
So I didn't even dilate at all. So they had to call her like a superior doctor, a female doctor. And when she came in, the last thing I remember, because I was very weak at that moment, I held her like this. I'm like, save me. And she was like, oh, now. Because now they checked the baby's heartbeat and it was in distress. They were like, yeah, we have to go for Caesar. They call it Caesar, C-section, right away. I'm like, yes, please. Like, right now. I want it now. That's the last thing I remember.
I had come with my hospital box, so everything was packed, bedding mats, everything. They took out one, they told me to lie down. Nobody told me that somebody is going to put their entire hand into your betting canal. It was crazy. It felt like somebody was invading my body. But that's something that, if probably I was informed before now, I would have mentally prepared for it, right? They said I was 2 cm dilated. I didn't know as a first-time mom that I needed to be 10 cm dilated before I'll be allowed to push any baby.
The doctor told me, hey, listen, you're going to be here for one hour. Yeah, I don't like your BP. I don't like how high it is. You're going to be here for 1 hour. And if we check you again and it's this high, we need to induce you. And this was like a week to my due date.
Hypertension is a whole different ball game. Let's look at women in different categories. Category 1, she was a known hypertensive before she got pregnant. That's what you see before 20 weeks. 20 weeks is halfway. So if it happens that you check the blood pressure twice and it's higher than it should be before 20 weeks, she's a known hypertensive. That one may not entirely be caused by the presence of the pregnancy. That's 1. 2, if the hypertension happens after 20 weeks, then our assertion is that it was the pregnancy that caused it.
I was about 180 over 110. So they were watching me like a hawk. Different people would come, neurologists, everything, like every professionals, they were in front of me. They'll be discussing about me in front of me. I'm like, help me. I just need this pain to go.
My blood pressure is really going really up now and it's not good.
So I just laughed. I said, doctor, look, listen, my due date is next week. Let's just wait till next week. I'll be fine. Doctor said, no, doctor now told me, say, it's not about you. Don't worry. No, you are not the topic of discussion right now. If this BP is as high as we're seeing it, it means that you have preeclampsia. It means that we need to induce you immediately, or you're gonna die. And I'm like, I thought the doctor was whining me. I'm like, die. This word is so sweet. God, what? Die? The doctor was like, yes, you're gonna die.
The word eclampsia essentially means convulsion. Preeclampsia is like a step towards that. So when you now start having the extreme end of it, hypertension becomes there, affects the woman so much, then you have eclampsia.
The doctor said, don't induce her yet, her BP is high. I'm like, who's BP?
The thing about preeclampsia is that if it's just hypertension in pregnancy and there is no element of preeclampsia, as I said, preeclampsia means it's affecting the mother. So that means it's affecting the liver, it's affecting the kidney, affecting the heart, affecting all the organs of the woman's body. That's when we start calling it preeclampsia. Preeclampsia never gets better, it continues to get worse. That's the way it is designed. More often than not, when we manage it, what we are hoping for is that we buy some time for the baby to grow. And the problem from all research, even though research is still ongoing, is that it is that placenta that's the problem. And what we would love is to remove the placenta and let the baby grow, which is not possible. So more often than not, if it starts to affect the woman so much, we tend to want to deliver earlier. And then at the extreme end, if it is not properly managed, it goes the other way. The woman can start having convulsions, which is when it's now called eclampsia. She can develop stroke, can develop some extreme conditions you can find in hypertensives. Sometimes in rare cases, heart failure. Kidney can shut down the kidney, shut down the liver. You understand me? So those are extreme conditions.
And they were able to bring down my BP at some point and, induce me and then brought out the baby.
When my baby came out, they were like, bring her baby to her chest. So they brought my baby to my chest. I held my baby. I cried. And then I pushed and then she came out and like, I heard my baby's cry. I'm like, okay. I did this.
They put oxygen in my face and that was it. And I counted down. And when I woke up like, in my mind, it felt like 5 minutes. So when I woke up, I saw the doctors over me. And the first thing I did was, remember, there's maternal instincts. I was already nesting, I was already prepping, I already prepped for my baby, shopping and everything. That's by the way. So I touched my belly. And the first thing I asked was, I didn't even care if they did a surgery, if they fixed me. I'm like, where is my baby? Did my baby survive? And the doctor was smiling, yes. You have a baby boy. I'm like, oh my God, I have a child, I'm a mom. Everything stopped. Literally, even to the point of temperature. Remember, I was boiling. I first touched my body, it was normal.
I just said, baby's out, but this time I was in so much distress. I said, this is not normal, please put me to sleep.
But the feeling I felt at that moment is a mat. You know when you step on a foot mat, everybody don't step on the foot mat. That's how I felt. For some weird reason, I felt really deflated, like a balloon that was popped and was used. That's how I felt. And I looked at the child, I was like, I'm supposed to flog you. Like, why did you make me go through all this kind of thing? Because my other kids were smooth. And just look at the baby. The baby's not even big. Do you understand? The baby was not big. I thought maybe the baby would be so huge. And that was so again, that's why I told people, nobody can teach you childbirth or motherhood or being a woman. But we do things very differently. The way it will happen to you or for you will not be the way it will happen to somebody or for the person. It's just very different. Because I mean, 3 children, had 2 smoothly, and then the third one that's supposed to be very smooth now became a problem. But I'm very glad that, I got through that stuff. And I'm like, you know what? No more babies. No more.
It's a process. I'm 7 months postpartum now, and I don't even know if I'm healed.
For my healing process, so there's this thing where you have to go to the clinic for checkup for like 6 weeks. So, I kept going to the hospital, and then, they would always clean up. I wouldn't be able to like have my bath, but I had family. I had like really great support. So they were the one who really helped my healing process. My husband was really, it was a rock. I remember they were calling him husband of the year at the hospital. So just really having family with me was one of the things that, really helped me to like really heal faster, because they'll just tell me to sleep, and just to, take my meds. But my blood pressure wasn't going down. For 3 weeks when I would go to the hospital, my blood pressure was still high. So really just having family around and all of those processes were some of the things that really helped, with my healing process.
Before I had my child, I felt like babies were too delicate for me to handle. Like, don't bring that, even at 1 month, don't bring that child close to me. I might just drop that child. But my baby at 6 days, I gave her her first bath, her second bath, and I was giving her a bath every day. And it felt like it was normal. Like, it just felt like something clicked in my head and I went into survival mode, right? So for almost 4 months, it was just me and my baby.
By the time I woke up in the morning, they'd come to clean up the blood and everything. And they had told you that, okay, you have to stand up in a few hours to move around. But the pain is still there, because I think the morning, that's when you realize the battle you had gone through. When they try to joke, you can't laugh because of the pain, But I survived that. But it's worth it when you have the right people around you, because I won't lie, if I look back, I used to tell my husband, I'm scared of getting pregnant.
You know who the people I respect the most? If you have more than one child, I give you heart. Because the journey is traumatic.
I've heard about women that have 10, 20 children. And my first thought on that was their strength. I don't know where they got their supernatural strength from, but they are not normal. They are not normal mothers like me.
So if people have more than 2 kids, like 3, 4, 5, 6, 7, till whatever number, it's not. I don't say it's because pregnancy was easy for them. I'd rather just think that they just love children. I remember feeling like, I'm not doing this again. Never. I told myself 1 is enough. I'm not doing it again.
I believe that Mother's Day should be actually celebrated like 100 times a year. When you see pregnant women outside, be like, why are they so unkempt? Now only you go get belly. Omo, they are not unkempt though. It's just natural. Please be nice to pregnant women. My beautiful handsome boy is a 2-year-old toddler running around the house, disturbing mommy, pinching my ears and my nose. But it's so adorable. I literally enjoy watching him go through everything. The milestones are beautiful to see. When your baby starts to clap or wave or smile at you, or maybe just look into your eyes, you just melt like, oh my God. Anybody could ask me for anything at that moment and I will give them. It's such a beautiful moment and it's worth it. It's worth all the pain. I don't even remember the pains anymore. There is no ideal birth story. As long as you give birth to a human being, kudos to you. You are a legend. You're a legend.
And although I had a vaginal delivery for my son, it was disheartening to encounter friends that had, unnecessary discrimination meted their way, maybe because they had CS. And I think it's also another problem that we don't talk about.
It is not easy. What are you telling me? You that you gave birth through vaginal process, you feel the pain before the baby comes out. Cesarean section, you will feel the pain after. And that will go on for another 1, 2, 3 weeks. You are in severe pain.
Yes, there's some misconceptions or stigmas that come with cesarean section. A lot of people are not well educated on cesarean section, and there's this idea of a Hebrew woman. So people usually associate cesarean section as a bad thing. However, there are certain situations where a cesarean section might be safer for both the mother and the child than a vaginal delivery.
There was one woman like that long time ago. I think I was a very young doctor then. We did a scan for her while she was pregnant. She was diabetic. Baby was very big. The scan told us baby was 4.5 or so. Big baby. That cannot come out through the vagina. We offered her cesarean section. She said no. Her pastor said she should not do CS. We counseled and counseled and counseled. She did not agree. At the end of the day, we just had to, and that is the thing. The absolute factor that determines you do CS is the consent of the mother, not the husband, the mother. If the patient does not want, you cannot force them. You understand me? And that's one of the things they teach us. You can have all your medical reasons, but if she doesn't give consent, you can't do the surgery. So she never gave consent, even though we saw all our reasons. Then she wanted to have normal delivery. She did have the delivery. But if I remember very well, we had to bring that baby out piece by piece. Because truly, baby cannot come out. So we first took out small parts, head, bring out body, one by one. And we had to break some parts so that I can allow the baby to squeeze. Of course, baby was long dead. Pastor came to the hospital the following, and then we asked Pastor, were you not the one that... He said, no, that his own wife delivered by CS.
We should even be grateful that God has guided us to have expertise to even do cesarean section. Some children that were delivered through the birth canal, they ended up having brain damage, injuries, probably could have been saved by having cesarean section. So one thing I need to clarify is, if your doctor explains to you that the best mode of delivery for your baby is cesarean section, please take the advice in the interest of the mother and the baby. We've seen cases where a child is having, labor is not progressing, the child is not coming out, the child is stuck in the birth canal, the mother wastes time, they don't want cesarean section. By the time it's getting late, they resort to cesarean section. This child has had a brain injury, and the mother still ends up getting caught. And this child ends up having cerebral palsy, depending on the severity, may not be able to walk, may be dependent on help for life. So the truth is, we don't expect, there is no reason for you to say, oh, because my baby was born through cesarean section, oh, will this baby do well? No. There's nothing to tell that this baby was born through cesarean section. And if a baby has grown up, there's nothing to tell. So the question should not arise, so will my baby fare well if it's delivered? If your doctor says that's the best option for the mother and the baby, please take the advice.
For me, I feel like women, we came to the world, to this world, to bear children. It's a lot of work.
I feel privileged. Maybe if I'll be in a different place if I didn't have my baby, but having her in my life has just made everything beautiful, and I feel really honored to have been able to conceive her, go through the process, birth her, and I'm still in the process of just getting used to the whole thing. So it's a privilege for me. It is a privilege, yeah.
This journey made me understand what Yoruba, when you give birth in Yoruba, they will say "Eku ewu omo," which means like congratulating you for escaping the danger of pregnancy or delivery. Because I think they don't say it enough how difficult this process and journey is.
It's just the natural process of life. That it's women that have to carry pregnancy, go through all that rigor, and it feels as if the man is doing nothing.
Cut them some slack. Let them breathe. They are going through a lot already. They are going through so many things in their lives. Cut them some slack. Let them be big if they want to be. Let them eat if they want to eat. Let them sleep if they want to sleep. And if they decided not to go to work, let them be.